the proclination of the upper teeth, the tendency for open bite, because the maxilla, the anterior maxilla is not able to grow vertically as the tongue is placed between the upper and lower teeth. So the anterior maxilla does not grow vertically, leading to open bites. The open bite and tongue thrust, they are always synonymous with each other. When there is an open bite, there has to be a tongue thrust, and the tongue thrust increases the degree of open bite to many folds. So it is a vicious circle that you have to break. These habits may lead to any other consequences depending upon how the digit is placed and how it is, like it is active, passive, it is how the amount of digit that is taken into the mouth. Everything will be responsible for the features, the clinical features that are visible in the mouth. So if there is active tongue thrust or active thumb sucking going on, the thumb is placed between the palate and the tongue. This leads to a pressure on the palatal aspect of the palatal vault, that increases the depth of the palatal vault, that narrows the maxilla. There is excessive working of the buccinator muscles. Upper lip is hypotonic, lower lip, that is the mentalis muscle, becomes hypertonic. Obviously there is lower tongue posture as it is beneath the tongue. This lower tongue posture plus tongue thrust may later on give rise to many forms of malocclusions. Then definitely these kind of features affect the psychological development of the patient. There is bullying going around, and then kids have this stress, anxiety, which may give rise to other aspects of personality development. Speech defects, that is particularly lisping, the S sound that just goes more affluently than the rest of the sounds. So then other habit is tongue thrust, which may develop as a consequence of other habit, or may be intrinsic, or may be genetic or hereditary. Now in this tongue thrust habit, you may develop an open bite, you may develop a class 3 habit, you may even develop an increased overjet depending upon how the tongue thrust is happening and where the tongue is being placed during the thrusting action. But even more than the action of the tongue, the posture of the tongue is equally important. If tongue is inferior and retruded in position, it does not allow the mandible to take complete growth. The mandible is retruded or underdeveloped. The tongue being retruded, it somehow reduces the airway space, giving rise to sleep disorders like obstructive sleep apnea. Then if the tongue is more forwardly placed, it may give rise to class 3 skeletal malocclusion. So these are the different types of features that are related to tongue thrust depending upon how the action is being performed. Even the posture, which is far more important because it's more constant and it's more continuous than the action of the tongue. You can go for various treatment modalities like cribs or rakes, that is tongue rake, tongue cribs, or bluegrass rollers or glass bead rollers, because you have to retrain the tongue. Even the mewing techniques as advised by Dr. Mike Mew are helpful for the kid because they train the tongue to completely seat on the palate, not just let the anterior aspect of the tongue touch the rugi area, but let the whole dorsum, like this, the whole dorsum of the tongue should touch the palate. That is the main objective of the mewing technique. That is where your tongue is supposed to be 24/7, other than obviously during the eating and the swallowing.